So I'm going to go ahead and try to share my slides here. You can tell me if it's working or not. All right, can everyone see that?
Yeah.
Okay, so we'll go ahead and get started. I just put together some slides, kind of a number of different topics here, but starting out with a case of somebody who may resonate with some of you ladies. So Judy Smith is a 68-year-old woman with a 10-year history of Parkinson's disease. She's been married to John for 42 years, and they have 3 adult children, 2 of whom live nearby. Judy's enjoyed playing with her 4 grandchildren, ages 4 to 10, on a weekly basis. Judy has helped to clean her home for about 4 hours per week and visits with a friend while John has physical therapy sessions for his back issues once per week for an hour. Once every 2 weeks, Judy enjoys going to get her nails or hair done at a local salon. She also enjoys massages once every 2 months. Judy has had a decline in her motivation for the past 3 years. She motivates herself to go to a yoga class once per week with the help of 2 friends that hold her accountable. She's had a little bit more trouble with feeling lightheaded over the past year. She additionally has had some depression and anxiety for the past 5 years. She's had some insomnia and wakes up 2 times per night with the urge to urinate. Since COVID-19, Judy has not been able to see her grandchildren or her adult children except for a socially distanced meeting when her daughter brings her groceries once per week. She's not been able to go to any yoga classes, to the salon, or out with her friends. She and John largely watched the news of the COVID crisis for many hours at all times of the day and night. Judy's anxiety and depression have worsened. Her insomnia is worse. She finds herself to be a little bit more mentally foggy. Judy has been napping in the day and is up at all hours of the night. She has had worse compliance with her medications. She feels that her balance is worse, and she's had a near fall at home. John is having some anxiety now as well. He's finding it difficult to get sleep at night. He is exhausted. They have been drinking more wine than usual every night. John worries that if something happens to him, there will be no one to take care of Judy, and the other way around. So I just wanted to highlight a few issues in the non-motor realm of Parkinson's first. Then we'll talk a little bit about integrative medicine, because it's something that I'm passionate about. We'll talk about a little bit of a lifestyle approach to being well with Parkinson's, and we'll end with some other kind of unique topics that I think no one's really talked about recently with possibly this group. So apathy. Apathy is a common symptom in Parkinson's, and what it really is a lack of motivation or interest. Patients find that they have a diminishment of goal-oriented behavior, and this often affects the family as well, because people, like caregivers, feel like that their loved one doesn't care. They don't start things or finish them. They seem very quiet, seem bored, they seem withdrawn, they lack enthusiasm. They sit alone all day and do nothing. They're couch potatoes. And it's really something that's different than depression or, and it's certainly not laziness, but it seems to be a dampening of emotional expression that can really affect things. What consequences apathy has is quite significant. It can have consequences in changes in the ability for people to do their activities of daily living. Caregivers can get quite distressed, and it can really affect friends and family that are close to the patient, because it seems like the person doesn't have any interest in doing the things that everyone gets together to do. It can also have a poor outcome of Parkinson's, lead to poor compliance with medications and treatment. As you can imagine, it can affect people's ability to be physically fit, their rehab outcomes, and can affect social isolation as well. So I just wanted to bring up this interesting cartoon that I saw very early on in the COVID-19 crisis. And I think it kind of resonates in an interesting way and brings sort of forward some interesting concepts that I think are things that I've been pretty passionate about. So with the COVID-19 crisis, as you can imagine, many of our patients, as I just showed you this case of Judy, who may have had some issues with apathy at baseline, may have had some issues with mood, have become increasingly socially isolated. They've had a lot more stress. They have become physically more inactive due to the fact that they've not been able to go to classes and get out as much, and a lot of physical therapy sessions and group exercise classes were really on hold at the beginning. And so there was this real worry in the physician, as well as I think patient populations, that with this issue, that this could lead to a downward spiral of patients getting worse with their Parkinson's disease. And we were really trying to find ways to connect people using other modalities. And so I think this type of group getting together with a support group like this using online resources. And I'll tell you about a separate support group that I've been running as well, are really kind of an exciting new way to connect people. And I know that you've had folks joining you from all over the world, and it's kind of represented a really unique opportunity to rethink about how we connect with people moving forward. There's also been an interest in things like mindfulness, which I'll touch on, as well as home-based online workouts to see if we can really get people exercising and keep them connected on a social level to prevent worsening of Parkinson's disease. Okay. I think there, as people are coming in, we're getting some muting and unmuting going on, so bear with me. So Lori Mishley and I have been doing some research into the concept of loneliness, even in the pre-COVID era. As people know, loneliness and social isolation increasingly highlighted as a global pandemic actually in the world right now. And as we're kind of moving through with the COVID-19 crisis, there's been a real worry that this could really affect our patient populations. So I just wanted to show you a few data points in the CAMPD study. I know Lori just came on 2 weeks ago, so perhaps many of you are familiar with the almost 2,000 patients that she's been following, looking at indicators in terms of their daily life functioning and the types of things that they're choosing to do, looking for what makes people do well from a Parkinson's perspective and what people are prognostic indicators that make people do worse. And what we found is that loneliness is actually quite a high risk factor for doing worse from a prognosis perspective. And so you see on this chart here that loneliness is as bad for you as exercising 6 to 7 days a week is good for you. And so when we put those two things together and we get social interaction and the types of things that we as doctors have been telling our patients to do, go out and do dance with Parkinson's disease classes, get out and do yoga classes, do rock steady boxing things, really we're thinking about, you know, ways to really influence disease progression in a very positive way. And in COVID-19, we really have to think about out of the box ways to continue to connect. This here represents a different sort of way of looking at the social predictors. And so when we look at tremor severity, a lot of folks have talked about tremor severity, and it's an embarrassing symptom, and that should really impact what we're doing with Parkinson's. But really, when we look at tremor, it doesn't seem to impact patients very much at all. It's really these sorts of things like having friends, being lonely. These things can really make a difference. And so if you look at loneliness here, you can see that it can really affect quality of life in an adverse way. And having lots of friends can really affect your quality of life in a really positive way. And so it's something that I think we as doctors are trying to look into more and trying to stress. And I've been educating my colleagues in the medical arenas to really be asking about this and seeing if we can intervene in positive ways. So I want to move now to the topic of integrative medicine, just to have a little bit of a chat around this, and we can kind of lay the foundation for perhaps taking a few questions at the end. So what integrative medicine is really this way of approaching medicine in a very different way, using not just a different out of the box. So we've taken away the concept of complementary and alternative medicine. This was the old name for this. And rather than having an alternative medicine state, we're really talking about using the best of two worlds. So looking at Western approaches, looking at the best sorts of approaches from that perspective, and then integrating other healthcare systems along with. And so the sense is that we're able to use the body's natural innate healing processes and looking towards using these and empowering patients to be able to hopefully get health in its truest definition. And when we look at actually even the World Health Organization, which are our leaders in defining things in medicine, the World Health Organization talks about health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so when we look at health, we're really looking at this more holistic, lifestyle-oriented approach, using the mind-body kind of connection, using this innate healing response, and really trying to get benefits in that realm. So we've done a little bit of asking people with Parkinson's what they really want. And a lot of the approach has been in the integrative medicine things to possibly fill in the gaps of what Western medicine may not fully address. And I think, you know, you guys as advocacy group can possibly look to help with continuing this dialogue with the medical community. So patients have said that they want to decrease their pill burden. They want guidance on what wellness and stress management strategies to incorporate. They feel that there's a lot of a barrage of information in social media, and they really want a sense of how to filter hope versus hype. They want better ways to communicate with their health care providers. And I think women specifically tend to underreport symptoms, especially in the non-motor realm. And so I think ways to communicate better throughout the healthcare process and possibly bring in some of these integrative medicine approaches to your Western trained healthcare providers may be really beneficial, because what we found in surveying people with Parkinson's is that up to 60% of patients in, for example, the United States are using integrative medicine approaches, and many of these folks are not discussing these approaches with their Western trained doctors. And so it often is, rather than being an integrated approach where people are really having a dialogue, there's two separate approaches and people are really not communicating well. People have also talked about the fact that they want a roadmap on what to expect in the future of their Parkinson's disease and help with guiding their care partners. And there's also been an increased recognition of gender-specific issues, and we'll talk a little bit about those. And I think really an uncovering of the fact that we have probably a lot of underserved communities, disparities in health in general. And I think that advocacy and redefining health as we move forward from this COVID-19 crisis is something that I think could be a real opportunity to do. So just a couple of words of warning from the integrative medicine world. So I think that if anything sounds like it's a cure or a miracle, I would really be concerned that there may not be great sort of promise. If treatments are only available outside of the US or Europe, I would be worried. If they're very expensive treatments or profit driven, if you only hear about them on infomercials, the internet, TV, or social media, I would have a grain of salt. And if they're asking you to stop conventional treatments, then I would also worry too. So my approach, and even the approach of someone like a naturopath like Lori Mishley, who knows a lot about both fields, is really to sort of consider really the value of things like levodopa treatment, Cinemet, and Western trained doctors and their advice, and use our knowledge of some of these other approaches in concert, and not to get off of Parkinson's medications. And she says that probably when patients come to see her, that one of the #1 things that she really does is actually tell them that she believes that levodopa is a good treatment and tries to encourage them to use it. And so I think if someone's telling you to stop these medications outright, I think you have to be really concerned and have a real talk with your Western trained doctor, and have a dialogue, and perhaps have the Western doctor discuss or understand what these other treatments are and give you advice. So from a supplement and herb perspective, a lot of patients have found that, you know, when they think about an herb, there's really a sense that there's very little that could go wrong. But I want to have you understand that many of these treatments are also metabolized through the liver or kidney and can affect these organs. Some can actually be toxic. They can interact with your own medications, for example, St. John's wort. There can be side effects that can be actually quite harmful in certain situations. And so, for example, cannabis, if you're planning to drive, or, you know, there can be decision-making capacities that are affected with certain types of cannabis preparations. Apathy can occur as a side effect with some preparations, and can really affect motivation to exercise. And so even if they are just herbs, some of them can have quite potent effects and side effects as well. It's important to also understand that many of these treatments, for example, turmeric in Ayurvedic practices, is really part of a large healthcare system. And really, it probably makes a lot of sense to take turmeric, make it in a curry, cook it in a fat, cook it with black pepper and other spices, can really affect the absorption into the body, into the brain, and really trying to substitute that with a powder formulation in a pill form without these other things can really affect its absorption and possibly its effects on the nervous system. So I think when we're looking at ways that these things have been beneficial in other treatment paradigms, it's important to think about these as they're practiced within more of a holistic healthcare system, such as Ayurveda or traditional Chinese medicine, or in a holistic diet plan when we're talking about these sorts of herbs and spices. It's also important to understand that many of these supplements that one is taking are not FDA regulated. So it's important to try to get a sense of what the formulations are, the safety of them, and also understand that we don't really know exactly what's in the products that we're taking in some of these instances. From a communication perspective, I think it's really important to try to talk to your doctors and tell them about all the things that you're trying to do. The last thing that we would want is to have people incorporating integrative medicine approaches and then not talking to their Western physicians and having some sort of bad thing happen. And then people are really in sort of a cleanup mode once something's happened. So I think communicating out the gate, listing supplements and herbs if you're planning to take them, having a dialogue with a healthcare provider to tell them about what integrative approaches you're considering taking, including your doctor in those conversations, weighing the risks and the benefits. If you try something new, it's important, and this is my approach with any treatments, some of these integrative approaches may be beneficial, and we may be covering up the benefits if we're trying to incorporate them while we're altering Western medications or other things as well. And then it's important to stay on your conventional therapy. I think, again, I don't think that it's a good idea to stop. And I think if a practitioner is trying to get you off of your treatments from a Western therapy perspective, I would really have a sense of why that hope is and have your Western doctor also advise you and get involved, because that is not my practice style, nor even folks in other arenas, such as I mentioned. So thinking about a lifestyle approach now to the treatment of Parkinson's, I just wanted to touch on some of these things. I know many of you know a lot of these things already, but I just wanted to kind of go over some of the things that I've been sort of thinking out of the box a little bit in my approach to our patients. I think it's important for you to reflect on your purpose. What is your purpose in life? If it may be to really enjoy time with your grandchild, for somebody else, it might be trying to scale Mount Whitney. It might be something that is really something that we really, as your physicians, need to get to understand about what brings you joy, what brings you a sense of well-being, what are your priorities in getting healthy, so that we can really help you, define what your goals of care may be. It's also important when we're thinking about a lifestyle approach to stay active. And I know many of you are very active. I know some of you are learning new musical instruments, trying new languages, reading books, trying crossword puzzles to stay mentally active. I know many of us enjoy travel a lot and family events. And I think that, due to COVID-19, much of this has been on hold. One way to stay mentally active is to possibly go through old photos, arrange some of the photos into albums, or write out your travel adventures, just to kind of reconnect with some of those things. When we're talking about being productive, though, I think it is important for us to set goals that are small and bite-sized, because I think many folks, and I'll discuss this towards the end, have a lot of pressure on ourselves about trying to stay productive. And sometimes this can actually lead to, in a negative way, to sort of being hard on ourselves and sometimes add to the stress. So I think rather than trying to read all of War and Peace, maybe trying to read the newspaper for 30 minutes a day or some short stories may actually be much more bite-sized. I think many of you know that my approach to Parkinson's is really exercise is like medicine. It is medicine. And I think many of us who are in the modern sort of paradigm of Parkinson's treatment really want to get people exercising from day one of diagnosis. And so there's many aspects to exercise. And so if you are feeling like you're in a rut, it's important to understand that mixing it up can really help. Doing it in a group so people stay accountable, doing something you love, getting out in nature, possibly getting a physical therapist or a coach, a yoga teacher can be really helpful. And when we think about the approach to exercise, I want to just highlight a few different things that can be helpful. So skill-based, so trying to do goal-oriented movement in which timing and space accuracy is helpful, and yoga can definitely hit that objective. Aerobic exercise, so trying to get the heart rate and the breathing rates up, can be very effective and can really help with sleep, mood. A number of chemicals are released doing cardio, so really part of the exercise prescription. Resistance training can be helpful. Balance training can be helpful. the mind-body approaches, and we'll talk a little bit more about those on a separate slide. And then since, you know, stiffness and slowness is part of our disease that we're treating, stretching and flexibility can really be helpful. And not to plug yoga too much, but I think yoga can literally affect all of these 6 important points, which were defined by local physical therapy groups as really important in all different ways. And I think it's sort of a one stone killing many birds kind of approach, I think, with something like yoga. So really open your mind to it. Sleep is really key. I think Sharon and I have had a lot of hours of talking about the importance of sleep over the years. And I think this is probably something that is really underrated by many of us, but it's really like floss for the brain. It can really be when we're detoxifying the chemicals that are building up in our nerve cells, and really can be very replenishing. So it's important to try to get consolidated sleep if you can, and try to be good about setting a schedule in your day every day, and trying to set a set bedtime and a set awake time. And if you're having a hard time in the COVID era trying to keep everything organized, I think writing out a day-to-day schedule can be helpful. Trying to, and for people who maybe, you know, finding exercise is really a huge hurdle, even setting out something like walking 5 minutes every hour can be a way to start. And so many folks talk about trying to get an hour a day, but if you spread this throughout your day, it can actually be a more bite-sized way to get things done. Getting good cardio, as I mentioned, can really help sleep. Minimizing social media news to 30 minutes a day if you're somebody who tends to be susceptible and gets anxious off of this. In the case that I presented, this is a very common scenario. A lot of us are watching or engaging in way too much social media, and really it can affect our mental state and really keep us in this zone of feeling hypervigilant and stressed throughout the 24-hour cycle, and this can affect our sleep time as well. So if you can wind down towards bedtime, get that 2 hours maybe of wind down time where you're really listening to quiet music, doing something soothing, reading a book, and even if it's an old school book, it really can affect your quality of sleep. Some of the blue light that we're all exposed to on screen time is really, you know, a lot of that going on right now with all the ways that we're connecting, even through Zoom meetings, even from a social perspective. And so be mindful of that. One can consider melatonin if you're having sleep issues. And then I also want to caution people that sleep apnea is actually very common even in skinny women with Parkinson's. It's not just the heavy men with large necks that many of our docs are looking and screening for. If you're having a lot of snoring or gasping at night, you feel unrefreshed after sleep, it really is something that we are seeing in all populations, and something that I want people to look out for. And once you get treated, if you have sleep apnea, it can really make a world of difference in terms of your wellness and feeling awake. Nutrition, I'm not going to spend a lot of time on this because I know Lori Mishley probably talked about this. This is largely from her research, but just the bottom line: Mediterranean diet, a high fiber diet, looking at color, lots of fresh fruits and vegetables, spices and herbs, healthy fats. That's really the way to go. What not to eat. If you're on Cinemet, trying to avoid Cinemet around the times that you're trying to avoid protein around the times you're taking your Cinemet. Minimizing things like processed foods, red meat, sodas, canned fruits and vegetables. Again, a lot of this is from Lori Mishley's work. Dairy avoidance is a bit controversial. She talks a lot about avoiding yogurt and cheese, but that milk and butter may be okay. John Duda, who's a colleague of mine at the VA, is a vegan and a strong vegan component. So again, you know, try your best to do what you can, but really trying to drizzle in you know, as many of these diet things as you can is definitely helpful, but I don't want people to get kind of crazy about this and feel like they're cutting out all the things that bring them pleasure either. Hydration is really key as well. So drinking 6 to 8 glasses of water a day, trying to stick with free water if you can. If you are susceptible to low blood pressure, things like a V8 or Gatorade that have salt in them is also very helpful. Really drinking coffee early in the day because it does have a diuretic effect. There are some ways to help with constipation through teas and things. And then cranberry juice can actually be helpful for prevention of urinary tract infections. When it comes to the gut, the Mediterranean diet can be very helpful. There's been a lot of chats on taking probiotics daily, but I've really been emphasizing more the prebiotics, so the allium vegetables like onions and garlic, looking at possibly things that are fermented like kombucha, yogurts, and things that have some prebiotics in them as well can be very helpful as well. Controversial, which supplements to be taken. I know Lori probably educated you a little bit last week. I won't get too into this. I would say the things that most people agree on in Parkinson's disease is definitely that vitamin D is important. If you're B12 deficient, it's important to replace B12. Many of us use melatonin, possibly taking more turmeric in your diet. CoQ10 has been studied in different ways. I generally don't tell people to take it, but I know Lori is a proponent of that. And so again, I think trying to get a lot of this through a lot of healthy nutrients in fresh fruits and vegetables and in your diet is probably the best way to go. And then if there are certain lab tests that come up as abnormal, it's probably good for people to get some of these labs screened once a year. They're mostly on panels that geriatricians or internists are doing. So checking hemoglobin A1C, lipid panels, vitamin D, B12, these are all pretty standard. And I think for women, it's important to do a bone scan possibly once a year as well. So getting into some of the mind-body approaches, mindfulness can be tremendously helpful, and there's a lot of resources out there. If you live in Los Angeles, I would point you to Inside LA. There's a lot of apps to get started, and even if you can get started for 5 minutes a day, it can actually be very helpful to do some of these practices. We'll touch on a few other things as we go through, but I think there's a ton of great sort of resources out there, from gratitude practices, loving kindness practices. If you go on Inside LA, for example, there's tons of short things like that, 5 minutes, 10 minutes, that can be really helpful every day. Journaling can be helpful. Doing some breathing exercises, getting out in nature has actually been shown to be very restorative. There's been some sense that being in plants, being in the garden, actually there's certain chemicals that plants release that can really affect our body as humans in a positive way. Prayer, if you're a religious person, can be very restorative. Having some fun, so laughing, singing, dancing, music, art, all very helpful as well. So think about trying to incorporate a little bit of all of these if you can. These main slides that I'm talking about: exercise, sleep, diet, these mind-body approaches. If you're doing none of them, maybe pick one and start 5 minutes even a day can really be on the road to getting some of these incorporated. And then I wanted to spend a little bit of time on social connection. So I've showed you some data on why social connection is important. And just for populations in general, the current literature in aging well is talking about the fact that if you're lonely, it's as bad for you as smoking every day, or if you're obese is bad for you. So it can actually have effects on your heart, on stroke risk, on risk of death, on other risks. And so it's really something that I think is understated and not very well discussed, but can really make a huge difference. And I think that just showing up to a group like this, making some friends, possibly reaching out to family or other folks in your world, and all the more during this COVID-19, is really important. And I think that it's really been understated. And I think we really need to identify people who are lonely and are lacking social connection and try to intervene in a positive way. And I think that this group may be able to even possibly volunteer in a way to reach people who may not even be able to connect through this sort of Zoom modality. There are folks that are out there, possibly in your neighborhoods, possibly in the Parkinson's world, that don't have an internet connection, that don't have a computer. And maybe we can reach out to those folks through some call groups, maybe finding some phone numbers of people in your neighborhood, checking in with somebody every day that may be less fortunate than you, that may be more isolated than you, can really make a difference in how you feel, since volunteerism can really do the brain good, and also how they feel as well. So I want to spend a few minutes, just because we have a group of women here, to talk about the fact that I think finding somebody who may be your tribe, who might be your Parkinson's advocate, who may be your confidant, as women is really important. And I think it may be that women may find that they are really needing somebody outside of their spouse, outside of their direct family, to really be their cheerleader in this journey with Parkinson's. And so I really want you to think about who that might be in your world. If you're early on in Parkinson's, I think it's important to identify somebody who may be able to come to visits, who might be that extra pair of ears. It may be your husband, but it might not be. It might not, that person might not be the right person for you. And I've had a lot of folks over the years with Parkinson's find an old friend, find a sister, find a neighbor, find somebody else that they may not have thought about in their direct world that might really be the person that might be their confidant, their cheerleader in this journey. And so I really want you to start thinking about that. In terms of other social connections, I think that exercise classes online, this type of support group online, so valuable. Possibly, as I mentioned, having Zoom family time can be really key. I know Sharon's been doing some of that. We've been doing some of that with my parents. We've set this as a once a week thing where we get my sisters and their kids, and we spend an hour over a coffee on a Sunday morning to try to connect with each other. And I think it's just so valuable to have that time. And if you're really missing your grandchild, it might be a way to do some FaceTime or Zoom with them and read that book that they really love. My mom's been doing that with my nephew, and it's just been a super cute way to bond, I think. So again, really think outside the box, think about those folks. And I've been connecting with people from high school, from middle school, from all kinds of folks, and really even people that I might have just sent a Christmas card to originally, trying to think about how to pick up the phone and have a real talk with them. And it's been a great opportunity, I think. I want to bring your attention to the PMD Alliance support groups that I've been hosting. They've been going really well, and we've had a tremendous number of great leaders in our field volunteer their time for an hour. So if those of you who don't know about this, I can share this link with Sharon. We have probably, I think this week we're taking the week off, but we've had, we'll continue to have these throughout July. We have Tony Lang coming up, Kailash Bhatia, some real world experts in Parkinson's. And many of these are archived to YouTube. And so you can see some of the folks. We had David Leventhal, who started Dance with Parkinson's, some of our local leaders, Sarah Ingersoll, who does the Walk Around the Rose Bowl. So just a really great mix of folks. And so I'd really urge you, Lori Mishley came on, and I think that's her second one that we've done together. Really urge you to get connected with folks. So I want you to also think about, we've talked about a number of prescriptions for self-care. Thinking about that time for taking this time for yourself to take care of yourself, but also for your caregiver or your loved ones in the home as well. So some of you may have a spouse or a child that you live with that is caring for you, or possibly you're caring for adult parents. And I think as caregivers, that role can be very draining. And so I want you to think about the fact that, you know, as a caregiver, you may need to put that oxygen mask on first. And it's really important to take care of yourself before you help others. And I think we do this not well as women. I know I tend to give a lot to others and find myself depleted sometimes. And I think that taking that time to take a break, taking that time to check in with myself and say, you know, I'm feeling kind of low energy. Maybe it's time to just, you know, take the day off of everything else that I've scheduled. You know, that, I think giving oneself permission is just so important. The other thing that I think is really important is having somebody like a battle buddy to call and check in with. And I know I've had some girlfriends that I've really been relying on more when I've felt burnt out. Picking up the phone to talk to someone has just been really important. So, you know, and sometimes it can even be that we get so sort of helpless that we feel like, you know, we really get in trouble. So I think having these suicide prevention lines, and it may not just be for you, it may be for anyone out there that you are connecting with. I think, you know, in this time of COVID-19, many people are feeling lonely, helpless, and really feel like they really need some help. And so, you know, keeping these numbers handy, being there for people in your world, really important. So this concept of a battle buddy, many of us in healthcare have identified someone to check in with every day, every week. I've been having happy hours virtually with friends. And so it's really just so important to check in. And so I want to emphasize these last couple of slides. So be kind to yourself. Many of us are caregivers. I know a lot of you as women are caregivers to young children as grandparents. Sometimes you're taking care of older adults in your home, maybe your parents or in-laws or other folks, or perhaps your spouse. So really important to identify all the roles that we're trying to fill and realize that many of these jobs can be full-time jobs in and of themselves. So expecting to do all of these things well is actually totally impossible. And sometimes it's just good to be good enough. Let go of those expectations. You may have had someone who came to your house who cleaned your house and kept it immaculate. Maybe you're not going to have that house now that's immaculate. Maybe you're just going to, clean up just so it's good enough. And that's okay. I mean, I've been letting go a lot. As Sharon mentioned, I actually have 2 teenage sons and a third who's he's 11 now in grade 6. We've had the stressors of having to homeschool a little bit, have them do some online schooling and motivate. A lot of us would have had children in camp and now have to entertain our children at home. And, maybe they're not going to learn Chinese. Maybe they're not going to cure, cancer while they're home homeschooling. I think, letting them play some video games every day is just as good as it's going to get for me. And that's okay. I have colleagues that have been tremendously productive, writing up all these articles every month. And I have friends that are painting their whole house and cleaning out their garage. For me, that's not going to happen. And that's okay. I've just decided that it's okay. This is really going to be a marathon. It's not a sprint. So for me, I've been self-pacing. I've noticed that I've been emotionally exhausted because I'm really trying to support so many people, my patients, my family, and my friends. There's a lot of people that are relying on me for emotional support. It gets exhausting. So I think it's okay for me sometimes to sleep in. I've been just taking a break here and there, getting some rest, taking some alone time. If you're stuck at home with a spouse all day, maybe getting out and just going for a walk with a different person or going for a walk alone. It's okay. It's important to give yourself permission to be okay, just not perfect all the time. And, it means making a sandwich or having a bowl of cereal for dinner, that's okay. We've gotten around that. I put together this slide. I actually, early on in COVID, was worried about a number of my colleagues on the front lines, and I worked with this woman who's pretty magical. Her name's Mikhail Moskowitz. She actually came on that series. That's how I met her, through this support group series that I did with the PMD Alliance. I saw something that she posted on Facebook that really resonated. And we actually worked together to come up with this series of emotions. And I think if you look at these emotions, many of us are feeling all of these on a regular basis. It's not just the frontline healthcare workers. And I think there's things like frustration, things like grief, things like cope, all kinds of things. And I think all of us are dealing with all of these emotions on a regular basis. And so I just want to spend a minute talking about a couple of these things specifically. I think grief is something that has been under-identified in us as a population. I think it's something that many of us are feeling. And I want to have you read a little bit about this and point you in a couple of directions. So grief is not just about a loss of somebody dying in our homes or a loved one. It's really about grieving a number of things in our lives right now. Many of us as grandparents may have been attending the wedding of one of our grandchildren, or maybe having a loved one who passed whose funeral we couldn't attend, or we're having a loss of freedom. Some of people had made trips of a lifetime that they were planning, lots of different things that they were planning to do this year. And we've really had a loss of normalcy, a loss of connection, a loss of safety, and there's just been a loss of many things. And so I think if you go to this website, Whiteboard Psychology, you can read a little bit more about this. And David Kessler, who luckily is amongst us here in LA, has been doing a lot of work in grief. He actually worked with Elizabeth Kubler-Ross to define grief before, and he's written a recent book about this issue and speaks about it specifically during COVID-19. So he says, I did not want to stop at acceptance when I experienced some personal grief. I wanted meaning in those darkest hours. And I do believe we find light in those times. Even now, people are realizing that they can connect through technology. They're not as remote as they thought. They are realizing that they can use their phones for long conversations. They're appreciating walks. I believe we'll continue to find meaning now and when this is over. And so when we look at things like silver linings, for me, I've been taking a moment to pause and reflect, to be present. I've probably enjoyed the birds in my backyard and flowers more than I ever have in my life. We realize how uncertain things can be and what we've taken for granted in life until now, realizing how important social connection is. And I think that social connection actually is something as key to human survival as water, food, and shelter. Human connection is just so key. It's one of these fundamental needs. And our global connection is also important. We've realized that this virus came from somewhere else and it can affect us here in this country. And so what we're doing for each other, wearing masks and things, keeping each other healthy is just connecting ourselves to one another even more. I've had new respect for our planet, Mother Earth, realizing this altruism, as I mentioned, how each of our behavior is so important in preserving our future. And I've had tremendous gratitude for the people in my life that I may have undervalued before, things like the postman, the grocery store workers, our teachers who've done such a great job to educate. As healthcare, there's silver linings as well that I'm seeing. I think we're really shining a light right now in social inequalities that our healthcare systems have had to date. We're realizing that COVID-19 is affecting certain populations so much more than others. And I think we really have an opportunity to change healthcare in a positive way. And I think you guys as a women's group in Parkinson's have an opportunity to advocate for things that are gender specific in this disease. And my last slide will highlight a few ideas that I have. I think we have a chance to break down barriers from a telehealth, insurance, and isolation perspective. We have a way to appreciate everyone on the healthcare team. I think it's broken down for us, the doctor role versus nurse practitioner role. I think we're all working together just for the good of the system right now. And we're realizing that some of these unsung heroes, maybe some of the integrative medicine docs that are prescribing things like yoga and mindfulness. You see that cartoon that I put up that was written by Boss Bloom in an article. They're really talking about many of the things as integrative medicine docs that we've been talking about, things like mindfulness, things like exercise. We've also been seeing the unsung heroes such as palliative care, and the role of things like advanced care planning, goals of care, conversations have really been part and parcel of what all of us are talking about. If I get sick with COVID, what would I want? What would my family do if something happened? And I think putting these sorts of thoughts in place for all of us, healthcare providers, each and every one of us out there, not just as patients, but as human beings on this planet, is really normalize some of these discussions, and I think allows us an opportunity to learn more about these areas. And my last slide here is just really about women with Parkinson's. I think this is such an important area for advocacy. I feel, having taken care of a number of women, even though I do run our Center of Excellence at the VA, I've had the pleasure of taking care of a number of women and working with them on how to address this disease better. The Parkinson Foundation has spent some time talking about this, but I just wanted to add my few cents. So I think that women with Parkinson's tend to have a lot of guilt. I think women in general have a lot of guilt. I do. We're never perfect. We're never done enough for everybody. I think we always worry about everybody else's needs before ours. Women with Parkinson's have more needs. We often end up taking care of people not just in our generation, but tend to be the providers for our grandkids, tend to be the folks that are taking care of our parents. And so there's a huge burden of needs on ourselves, and we tend to become overscheduled. As I mentioned, these unique issues with finding your tribe and your advocate, I think looking outside your home, looking outside your dyad of possibly just your husband as your cheerleader, who might be your advocate, is helpful. I think many male caregivers are unprepared, and we in the healthcare system and in general with advocacy need to help with that. I think women, as I was looking through the Parkinson Foundation write-up on what they found, tend to be more often single, divorced, or widowed than men. They may not communicate well with their providers and tell them what their needs are. Even to their caregivers, they may not be communicating well. There needs to be more advocacy for research and care that are specific to women with Parkinson's. Most of the research studies that I've read are about men in their late 60s. They're married, they're affluent, they're white. This is the cookie cutter population that all of our studies have been in. And I think we really need to expand that and break through that barrier of getting research done in not just, white populations, not just men, not just this age. We really need to be looking outside that box and find ways to connect women to do more studies with them and what their needs are. Women have possibly hormonal influences throughout the disease state. If you happen to be going through menopause, this can affect your Parkinson's. There was some thoughts about breast cancer being something I know Sharon and I have talked about that. Osteoporosis may be some issue that is separate or different for women. Women have lower body weight, so their distribution of medications is different. They tend to have more dyskinesias, more non-motor symptoms. They tend to have more prescriptions of antidepressants or benzodiazepines and less prescriptions of other medicines prescribed to them. They have less access to deep brain surgery for whatever reason, less access to specialty care. So many women don't see neurologists or movement disorder neurologists, especially if they're African American. This seems to be a real disparity. So we really need to find tools for communication, better tools for symptom identification, and really better ways to be researching and meet the needs of women in a different way than we have in the past. So I really urge you to advocate for yourselves and to answer any questions you may have. I think that's the end. That's my last slide. So I'm going to stop sharing at this point.
Okay.
Hopefully that was somewhat of a help to you. I kind of popped around and talked about different things, but happy
we do have some questions in the chat. I'm just going to pull out a few that were relevant. Let's see. How can we assess? Well, let me give you a couple of them. One person wanted to know if Pilates is as good as yoga.
Pilates is similar to yoga. I think that Pilates may have less mind-body connection stuff, but it depends. You could probably incorporate some mindfulness before and after and get some benefits. Pilates, I think, still relies a lot on breath connection, and it has a number of things. But I think yoga, the reasons that I like yoga is it has, these different components with breath, mindfulness, and meditation, as well as the postures, which is lacking in some of these other approaches.
Someone asked about learning new skills and whether they provide the same benefits as exercise.
So I think it's exercise, as I showed you, in its full entirety includes cardio and all these different points. So I think that learning new skills can replace the first one that I talked about. It's definitely helpful though. All of these things are, it's not one or the other. I think if you can incorporate some aspects of it and mix it up, I think it's really the way to go.
An easy one, is Perrier considered a soda to be avoided?
No, Perrier is not considered a soda.
What about the LaCroix, the flavored sparkling water?
I think you would have to ask Lori about, I don't know if she specifically looked at that. I think some part of the canning may be affecting some of this, but so I think if you can do bottles, it's probably better. But sparkling water in general is fine.
Okay. A couple questions about taking Cinemet with protein. When doctors said to take it, one person's doctor said specifically to take it with protein. Others, what if you take your Cinemet around mealtime? What do you do?
So I usually say to take it an hour before meals. I don't take it with protein. Protein directly competes with the absorption. So I'm not sure why that would have been, but we say to take it an hour before meals and then avoid protein, by an hour. And then if you've just eaten, probably to wait at least an hour, or if you can especially if you ate a heavy protein meal, because it does directly compete. They've actually done studies with Cinemet and drinking milk with it, and they've shown the curves are quite affected. It actually gets absorbed quite a lot later.
Okay. What are your thoughts on assessing and treating mycotoxins by lab results and probiotics? Seems the rage in functional medicine these days, and if everything starts in the gut, doesn't it make sense to dig into it?
Yeah, mycotoxins, I think that, those are the ones that are around fungus and stuff. I don't spend much time looking into that at all. I think if you had a known fungal exposure or something, it might be helpful to talk to somebody who is more, knowledgeable about that. I would probably, have an infectious disease doc or something weigh in on that, but it's not something that I do much of. And I don't do a lot of labs. I mean, I showed you probably the labs that I check, which are not anything near what the functional medicine folks would say. Functional medicine is another whole topic, I think, and they have a different approach. I think some of their approaches to lifestyle make sense. I don't spend a lot of time ordering large panels of labs that can be quite expensive and then using a lot of supplements that are very expensive as well. It's not part of my approach in general.
All right, and somebody wanted the slide with the labs that you asked.
Yeah, I'll send you the slides and you can send them around.
Okay.
Whatever.
I am gonna do a real quick poll, if I can find it. Hold on, we'd like to do this once more. This is about avoiding social isolation. So how do you avoid social isolation? What are the things you do? We'll give you 30 seconds to do this. And I've got a couple of messages. Okay. Oh. One person said that I guess she follows you on PMD Alliance. You always ask your guests this one last question. So what is your takeaway pearl nugget message of positivity for us to take away?
Okay. Good job. I would say the advocacy piece. I think you have a tremendous amount of women here that are, I think girl power and power in numbers is huge. We have not been focusing on this community in medicine. We just have not. For whatever reason, all the studies are on men and they're all on, the same, I told you, white, affluent, 60 plus who are married. Those needs of that population is very different than the needs of the folks that I've, hopefully highlighted to you. I mean, I'll send you that advocacy slide, but I pretty much think that, a lot of the issues that I see in women are just tremendously different. And I think that we need to be spending more time studying this and finding ways for male caregivers or other people to understand your needs so that they can really support you, and as well as us physicians support the needs that are of our Parkinson's patients that are women. So, I think you have a really special group here. And I think that the tribe that women have, the sisterhood is really key. And so I think this type of group where you can really get together and talk about what makes a difference to you is so, I think, freeing in some ways. And I think it's really so amazing that this group exists, and Sharon's, I know, spent a lot of time and energy, and I'm often telling her to be kind to herself and take some stuff off her to-do list, but I hope that slide that I talked about as well, the last thing I will say is that be kind to yourself point is not something that I just talk to patients about. That is something that I've given talks to healthcare providers, residents, fellows, leaders in my field, leaders in medicine, and very few people spend enough time thinking about how honestly emotionally tired we are in all of this time frame. Most of us, you guys are the grandmas, you guys are the ones that everyone calls, or the moms or the sisters or the whatever, that people are calling like, I'm so tired, I had a really bad day, or this happened or that happened, what should I do? And you're taking all of that on, and that energy and that, it does wear you down. And so I think finding a way to, put up sort of some ability to say, enough, I just, or sort of separate from that is definitely important, because I think we need to realize that this is going to be a marathon, and we all need to kind of pace ourselves. And I think that, giving ourselves permission is so much of what I think I do for so many of the Zoom, happy hours on Friday after a long week. And we're just like, even as healthcare providers or moms or, whatever, we all need to do this. And so I think if you can do that for yourself and then tell the women in your life to do that, I think it will be tremendously helpful. So.
Great. Can everybody see our poll results? They're listening to you. They're taking your exercise classes online, talking to their friends on the phone, online support groups, and getting together with family and friends. So we are, and FaceTime, Zooming with friends. So we are definitely not isolating ourselves socially. We are getting out there. So thank you, thank you, thank you. I think this has been terrific. I am going to, if you have any questions, I'm going to go to my screen share if I can find what I want to show you. And let's see, let me find mine. Where did it go?
There was one, just while you're doing that, Sharon, there's 1 or 2 private messages to me about severe depression and people being afraid to reach out. I think that's happening to everyone. And I really want to urge you, if you're feeling really depressed, to call one of those, hotlines if it's that bad. It's a very tough and stressful time. It's very, very isolating. And I think you just need to, realize that if you are severely depressed, that you really do, you're not alone. There are people, all over the world that are in crisis right now, just emotionally. And so I really want to urge you to get with, call a friend, call somebody, do something that's out of, it's okay to ask for help. That's what we're here for. And, it's just so important not to let it get to a place where you're really that low and that depressed, that this could be the first, typing this comment. And to me, I would just say, really, reach out to someone. This is the moment of change to really take your life and value it and ask for help.
Okay. Well, I want to thank you. And we are giving you a virtual tiara, which we give to
Thank you. I'll take that tiara and wear it all day with my boys and all the, I don't know if you can see this, but I went out and bought some pink stuff yesterday so that I can wear, and I wore my pink dress and pink earrings just for this event, since I love being around girls and I miss them. So
I'll bring you a tiara. Anyway, in 2 weeks, I hope I have the date wrong, we have Dancing Through Parkinson's with in Vertigo Dance Troupe. We're going to have a lot of fun. We're going to be able to dance. You don't have to, you can sit in your chair, you can stand up. It's for everybody. And 2 weeks later, we have Sue Wiley, who will be talking about her film Kinetics. And some of us saw it at the WPC last year in Kyoto. And it's a wonderful film about a woman with Parkinson's who happens to be Sue Wiley, who is on this call. So she will be talking to us from England. So Sue, we're looking forward to that. And you will be able to see the film before the discussion. So, and that is pretty much it. Stay safe and stay sane through these times. We don't know what's going on. It looks like we're going to have more isolation again in some states. Not good, but we'll get through this together, right? So,
right. Thank you, Sharon.
Let me stop the screen share. So thank you, everybody. Thank you, Dr. Subramanian. I will send you slides. We will have it. The recording will be ready. I don't know when, whenever I get my act together. And I'm trying to cut back. Honestly, really, truly trying to cut back. It's not, and beautiful tulips. Thank you. And we'll see you all in 2 weeks.
Thank you, Sharon.
Thank
Bye-bye.
you.
Bye. Thank you.